Hi, my name is Dr. Gootzeit. I work at Scheidelman Physical Medicine, and I'm here with our third or fourth live discussion with my patients. And the idea here is for you online who are coming to this live telecast, is for you to ask questions to my two favorite patients. Both of them have suffered with pain of maybe 25, 30 years of discomfort. One has had excruciating migraines, the other has had a syndrome called fibromyalgia. Fibromyalgia is a bear because people get $1 million workups and the rheumatologists still don't know what they got. And the reason they get treated like that is because they really have pain and it really is hard to understand what is going on. However, in our office, we have come to some conclusions about how to help. And I'm going to step out of the room because what my friends are going to say, my patients who are my friends, are going to say is too embarrassing for me to relate to you. I want them to say it because maybe you'll believe them. You won't believe me. So I'm going to be stepping out, and here they come. Stephanie and Michelle.
All right. Hi, ladies.
Hello.
Hello, good afternoon.
Good afternoon. So what I want to ask you is, I know Stephanie to our left and Michelle to our right. What has been your experience here with Dr. Gootzeit?
Would you like to go first?
I can do that.
Okay.
My experience with Dr. Gootzeit first started 6 weeks ago when I came in actually for an adjustment, and I was telling Raquel what I want to do. I wish I could get anti-inflammatories in my shoulders. And she said, oh, you can. So what I ended up doing was scheduling an appointment for PRP, and I had the injections put all the way up and through here. And end result is the fact that I have no more migraines. I've had no migraines now for 6 weeks, and before that it was about 2 a week or so for about the last 17 years. And then I've also done my lower back, so I can stand again every morning, and I haven't had that for I can't remember how many years. So that's the kind of the quick summary of mine. How about you?
My name is Michelle, and I'm a 73-year-old patient of Dr. Gootzeit, who I've been fortunate and blessed enough to be seeing for about the last 14 months. I've had multiple back and neck surgeries. I have fibromyalgia, arthritis, osteopenia, you name it, and I have it. It's been a number of years since I've had my surgeries, and I moved here about a year ago and started going into a great deal of pain to the point where I was losing mobility in my neck. I had a wonderful acupuncturist tell me about Dr. Gootzeit. I've been coming here ever since to him. Again, he's just a gem of a person, and the office is absolutely outstanding. When I first came here, Dr. Gootzeit pointed out to me, as the same with Steph, I had to turn my whole body in order to turn my neck.
Right.
So it's been a lot of treatments. Some people will need far less than I will, but again, I've got the complications from the metal in my neck and the fibromyalgia. But the shots are basically painless. I mean, just the needle just hurts for a short period of time. Mm-hmm. When I came here, my pain level was about a 6.5 to a 7. It's now a 1 to a 1.5. The benefits have been fabulous. And it's really important to take charge of your health, listen to what the doctors recommend to you, but you make your own decisions. And they are wonderful here about laying out different options for you, but in the end, you make the decision and they're fine with it.
Yep.
That's excellent. And Michelle, I know that, how did you find out about PRP?
Through an acupuncturist who I met at Rio Salado College. I went to a presentation that she gave, started talking to her about my issues, and she said, you have got to meet Dr. Gootzeit. I used to work with him. I used to work at Scheidelman Physical Medicine. I want you to go in and talk to him. And I did, and I was a little bit leery at first. But one thing I want to add to my treatment plan is that because of all of my surgeries, I have a great deal of scars in a lot of places on my body. And Dr. Gootzeit believes in neural, N-E-U-R-A-L therapy, which is lidocaine shots, and they will go into the scar areas because most of my scars are older, and they break up in your body from the inside, and the tissue starts pressing against the nerves, creating a great deal of pain. I don't know how many doctors actually know about this, but I just thank God every day that Dr. Gootzeit does. And I still come in pretty frequently for the lidocaine shots in my neck because it's going to take a while for all of this to go through my system and take place where I'm functioning at 100% again.
Yeah, that's amazing. It's wonderful to see how you guys have even brightened up since starting treatment, because you came in with so much pain. What are some of the activities that you're now able to do that you weren't able to do before?
First activity is I get out of bed in the morning without pain. So I never sit still. I'm always doing something. So I'm actually able, let's go simple. I'm able to, anytime, vacuum my house. That's pretty significant when you've had the volume of pain in your neck and your shoulders and your back. That simple task shouldn't be a big deal. So the fact that or picking things up, getting to the floor, back and forth, you know, it's changed my life as far as everything, from getting up to being able to take a shower, move things around, get to the grocery store, you know, get to and from work without any kind of discomfort. I don't think about getting out of bed now, I just do it, which has been, that's pretty basic and a big deal. How about you?
My activity level really hasn't changed very much. When you have fibromyalgia, and I also have chronic fatigue syndrome, you're very limited as to what you can do. I have not been able to use a vacuum cleaner since I was 40 and diagnosed with fibromyalgia. That's why I've always had a cleaning lady, but that's okay. I just wanted to be able to function comfortably, to be able to walk. My goal is to be able to dance again. And when I say dance, I am not talking about ballroom or ballet, but just freestyle and jitterbug with energy flowing through my neck that isn't going to put me in pain for the next 2 days. But I've never really been held back from the daily routine of things that you have to do, get out of bed and shop and whatever. There's been very little change with that, but the mobility is so much better. That's what's different.
Yeah, it's amazing. It is.
Yeah.
Absolutely.
Yes.
Everything you do, it's an improvement. And like you said, there's not the pain. I mean, you get shots, there's injections of lidocaine beforehand, and then you get the PRP injection.
Yes.
You know, and it's like 1, 2, 3. Okay, that's done. A little uncomfortable for a minute, but that's it. So when you go home, you don't feel funny. You could go right back to what you were doing, and you're just ultra aware. Oh, how's this gonna feel different? And then the next day you go, wow, I'm not feeling that. For me, it was instant. I can actually say it was instant because I don't know if it was the location or, you know, using the ultrasound to get to just the right spot as far as where the injections went. That was a big deal. It was kind of neat to see all that part of the procedure, but I would almost do it for somebody for fun if it helped them because it was that non-invasive, really.
Yes.
It's been a good trade-off, right?
Yeah, that's been wonderful.
That
it's been
injection,
such a blessing for both of us.
Yeah, that injection, okay, there we go. You're like, wow, right?
Yes.
Yeah,
Yes.
so I think everybody should, if you've got a pain or discomfort, find out if it might be an option because it's changed my life. Sounds like you too.
Yes, and Dr. Gootzeit is an extremely focused, detail-oriented person. When I'm here, I feel like he tunes out everything else that's going on in his life and in this office, and he is completely focused on Michelle and making her better.
Yep.
And when he asks me how I am, it isn't just, hey, how are you doing? He really, really genuinely cares and wants to know, and with his whole heart wants to help people.
Yep, he does.
Incredible.
Absolutely, he does. Everybody in this office is amazing.
They are
Yeah.
fabulous people.
Oh, you ladies are incredible. Thank you so much for your testimonies. I appreciate your time. Any
Oh,
final
sure.
thoughts?
Thoughts?
Yeah.
I have lots of thoughts. Things as far as what to maybe tell people about the office. It's scheduling is very flexible. Dr. Gootzeit works with people's schedule, fits people in a very short period of time, never has a problem changing anything, and is truly interested in your life. He really looks at all the different aspects of your life and how things could change. And you know, I was before I did my lower back, it was a long conversation. What do you? Anyway, I won't go into that. But no, he cares, and it's made a big difference that somebody cares too.
And how long did the procedure take?
My procedure, from the time when I came in and the blood was drawn and put through the centrifuge and I had my injections done, maybe 45 minutes maybe total.
Sounds right, Steph.
So
Yeah.
not long at all.
No.
And did you have to take any time off or limit
Nope.
your activities at all
Nope,
afterwards?
nothing was limited. Mm-mm.
Great. Great.
I'd like to add some other things, if I may, about
Yeah.
what I have done for myself. Dr. Gootzeit for me is at the top of my list, but I've noticed that I could use help in other areas. So I do see an acupuncturist every other week. I see a fantastic reflexologist every other week. And in February, I went to another presentation at Real Salado College, and I met a fantastic holistic doctor who's also an organic chemist. And he has been treating me from the inside out. So with vitamins and minerals and things for the gut and hormones, it tested me thoroughly from A to Z. And I think all of these things are working in conjunction with each other
Right.
and are producing wonderful results. But again, I started here about 14 months ago,
Mhm.
and maybe 6 months ago added these other components. So it's just been a life-changing situation for me. I couldn't be happier.
Yep,
Incredible.
absolutely.
That is awesome. I am so glad that you ladies were able to come in today.
Oh,
Thank you.
Thank you so much for your time.
You bet.
You're welcome. Thank you too for the opportunity.